Our enrollment has been quite successful. We have enrolled 12,800,000 members, 8 million being, most of them being members of the previous NHIF, and then about 4.5 million being members that were newly registered. As we are approaching the first, we saw a lot of people registering. The number went up. There was a lot of push for registration, you remember. And right now, the registration is stagnating. It's not moving up the way we expected. So what we have agreed is that as a result of this meeting, we are also going to work with the counties to increase the enrollment. We also realized that as people are registering, some of them at that particular time are not adding their dependents. So we have agreed here today that together with the counties, now we are going to do sensitization where we have the members who have registered and they have not added their dependents. So we are going to come up with a manual that will be given to the CHPs, it will be given to hospital staff that are working there when a patient comes and they realize that they have not onboarded their members, their staff, their dependents, they can quickly do that. But the key thing is to do early sensitization so that most of them onboard their dependents. So we have agreed on a strategy of how to do that, which will commence next week. The NHIF Act could not accommodate the rollout of universal health care. And therefore, we passed the 4 laws that will support, which was the legal framework that will support the rollout of the universal health care coverage. And therefore, we had to come up with a clear roadmap of now moving from the NHIF to the Social Health Authority. The key thing also that we looked at is we have now 3 funds as opposed to the earlier NHIF where there was only 1 fund, which was the contributory fund. But now, under Social Health Authority, we have 3 funds. That's the Primary Healthcare Fund, which will cater for treatment of patients at Level 2 and Level 3 facilities. And this will be provided free to those who are registered under SHA. And then the second fund is the Social Health Insurance Fund, which is a contributory fund for all Kenyans who have registered and have either they are salaried or they are unemployed. If they are unemployed, then they have to be verified through what's called the means testing or assessment of their income based on their status, and they will be the assessment will be done, and they will know exactly how much they are supposed to pay in terms of their contributions, which will be 2.75%. Those who are salaried will definitely, from this month, the employers are going to deduct their 2.75% from their gross salary to be paid to SHA on the 9th of November. So the shift is basically because we have 3 funds. I have talked about the 2 funds. The other fund is the Emergency, Chronic and Critical Illness Fund, which will be funded through the Exchequer. So you realize that under this new funding model, we have 2 funds that are catered for by the national government. That is the Primary Healthcare Fund and the Emergency, Chronic and Critical Illness Fund that is appropriated and budgeted for through the National Assembly. But this middle fund, which is Social Health Insurance Fund, is what is member contribution. So there is definitely need to shift from the NHIF to the Social Health Authority. The assurance I'm giving the public is basically one, that once the system stabilizes, they will receive their services without any interruption. 2, I also want to assure the public that they are going to get more benefits as opposed to what they are getting under the National Health Insurance Fund. the most important thing is every citizen who has registered can access free medical cover at level 2 and level 3. So our nation is going to have a healthy population because they will be able to access the healthcare. And as we go along, as we contribute as a nation, the huge disease burden that we were facing is going to be a thing of the past because the government has taken care of the chronic and critical illness funds to support those who are in need of support in terms of critical care. But the most important thing also that needs to be understood by the public is that for the first time since our Constitution 2010, that we are going to provide for emergency care as provided for in Article 43 of our Constitution, subsection 2, that every citizen is entitled to emergency care. I want to assure the nation that as long as we continue contributing to our social health insurance fund, we are going to offer quality care and